Hi, good morning, Ralph. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many of the things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, organizing skills, a polite and humble manner, and a helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. You can now start your role play.
Good afternoon, Mihiraa. I'm Douglas, one of the nurses looking after you today. I just got your request for a chocolate bar or a sugary soda. First, I want to say it's completely normal to have these cravings, and I'm glad you let us know instead of just feeling uncomfortable. My main job right now is to keep you safe, so before we consider any snack, I'd really like to understand what's going on. Can you tell me a bit more about what made you feel you need a high-sugar snack right now?
Oh, hello, Douglas. Honestly, it just hit me all of a sudden. I was just reading my book, and my stomach started growling like crazy, and I felt this intense need for something sweet, specifically a chocolate bar. It's a habit, I suppose, to reach for something like that when I'm feeling a bit peckish in the afternoon.
I completely understand that intense hunger can be very persuasive, and habits can be a strong pull. Mihiraa, to make sure we address this safely, the next step is to rule out whether your body is actually signaling that your blood sugar is too low, which can sometimes feel like an intense craving. So, apart from the hunger, can you describe how you're feeling physically right now? Are you noticing any other new symptoms, like feeling shaky, dizzy, or maybe a bit sweaty?
Now that you make me think about it, I do feel a little bit on edge, not quite myself. I wouldn't say I'm sweating, but my hands feel a tiny bit shaky, and I felt a bit lightheaded when I sat up to call you. My vision is fine, no confusion there. It's mostly the hunger and this odd, jittery feeling inside.
Mihiraa, I want you to understand why I'm being so careful about what we give you right now, because I truly care about keeping you well, not just today, but for years to come. When you eat something like a chocolate bar or drink a sugary soda, it floods your bloodstream with simple sugars almost immediately. This forces your blood glucose to shoot up very quickly, which puts a tremendous strain on your body. Imagine your blood vessels and organs being overwhelmed by that sudden rush. Over time, if these rapid spikes happen again and again, they start to cause real damage. High sugar can injure the delicate nerves throughout your body, leading to numbness or tingling, especially in your feet and hands. It also puts a heavy workload on your kidneys, which have to filter all that excess sugar, and it can harm the tiny blood vessels at the back of your eyes, affecting your vision. These are the long-term complications we want to protect you from, and that is why every food choice matters. Now, please hear me when I say that the craving itself is nothing to feel guilty about. Mihiraa, first, let me reassure you that it is an incredibly common challenge for people managing diabetes, and you are not alone in this. These cravings do not mean you are failing. They are simply a signal that we need to adjust your diabetic diet together. With some practical swaps and a bit of planning, this whole situation is completely manageable, and I am confident we can find a way that works for you without making you feel deprived. Does that make sense why I'm cautious?
Oh, I see. So the craving is like a false alarm? I just assumed because my body wanted sugar, I should give it sugar. But I do worry about my kidneys. My doctor mentioned that. So what on earth can I have if I can't have the one thing I'm desperately craving?
I understand that feeling completely, Mihiraa, and I want you to know that your craving isn't a false alarm at all. Think of it more like a genuine signal from your body that got a little mixed up. Your body is absolutely right that it needs fuel, especially right now with your blood sugar on the lower side. But the brain's quickest instinct is to shout for pure sugar because that is the fastest fix. The good news is there are much gentler, healthier ways to answer that call. For immediate relief when you feel shaky like this, a small glass of milk and a couple of plain whole grain crackers work perfectly without causing that damaging sugar spike. For the future, when a craving strikes but your sugar is stable, you can reach for a handful of plain nuts, a pot of creamy plain yogurt, or even a sugar-free flavored beverage, which often satisfies the simple habit of tasting something sweet. Now, this leads me to something equally important, which is taking your medication exactly as prescribed. Your metformin, for example, is carefully dosed to regulate your blood sugar smoothly throughout the day. When you stay consistent with it, you maintain its full effectiveness, which is your strongest shield against complications and sudden emergencies that could land you back here in hospital. Mihiraa, do you have any concerns or questions?
That sounds reassuring, thank you. The milk and biscuits for now are fine. I do have a question though. I take my metformin every morning, but sometimes when I'm busy, I skip lunch. Could that be why I'm feeling this way now? And are there any other habits I should build to stop these afternoon cravings from happening in the first place?
That's an excellent question. And yes, skipping lunch is a very likely reason you're feeling this way today. Mihiraa, to maintain stable blood sugar levels, it's essential to have regular, balanced meals. Don't skip them. Also, stay well hydrated with water throughout the day and monitor your blood glucose as prescribed, especially before meals, so you see the direct effect of your habits. For sustainable lifestyle habits, I suggest incorporating some regular light exercise, like a 15-minute walk after meals, which helps your body use glucose better. A very powerful tool is to keep a simple food diary. Write down what you eat and when you get these intense cravings. It's the best way to identify your personal trigger times, so we can plan a healthy snack just before that happens. We call that being proactive instead of reactive.
A food diary is a good idea. I can do that. But what if I'm at home and I feel really sick, like more than just a little shaky? When should I really worry and call for help?
That's a critical part of the plan, knowing when to seek help. Mihiraa, if you experience signs of severe hypoglycemia, like extreme shakiness that doesn't improve after having a snack, confusion, or fainting, that requires immediate medical attention, call for help right away. Conversely, watch for signs of severe hyperglycemia, which means very high blood sugar. These include excessive thirst, frequent urination, nausea, and deep, rapid breathing. If you notice those, don't hesitate to seek help. Now, Mihiraa, could you please confirm your understanding of the discussed plan?
Oh, yes, I understand now that I should choose a healthy snack like nuts or yogurt instead of sugary treats, take my metformin regularly without skipping meals, and watch for warning signs like extreme shakiness or excessive thirst that mean I need to call for help right away.
That's exactly right, Mihiraa. You've understood everything perfectly, and I'm confident you'll manage this well at home. Take care of yourself.